To start, for the right side of our head, we have the cranial nerve 5 sensory distributions. We have up top the ophthalmic division, which is innervated by branch V1. In the middle here, we have the maxillary division, which is innervated by branch V2. And on the bottom here, we have the mandibular division, which is innervated by branch V3. As well on the side, we have the masseter muscle, which is innervated by the mesenteric branch. And then for cranial nerve 5, we use the masseter as our electrode placement. We use a bipolar montage and we find the mandibular angle and then go 2 to 3 finger breaths up and go at a deep angle that's greater than 45 degrees. And next we are going to do the cranial nerve 3, 4, and 6 placements. For these, we use a referential montage. So we place a reference electrode and we will place that in the midline of the forehead. And that can be used for all 3 electrodes that we'll be placing. So for the cranial nerve 3, our target muscle is the inferior rectus. For cranial nerve 4, our target muscle is the superior oblique. And then for cranial nerve 7, our target muscle is the lateral rectus. And then over on the other side here, we have our muscles. We have the frontalis, which is innervated by the temporal branch. We have the orbicularis oculi, which is innervated by the temporal and zygomatic branch. We have the nasalis, which is innervated by the zygomatic branch. We have the orbicularis oris, which is innervated by the buccal branch. We have the mentalis, which is innervated by the mandibular branch. And then we have the platysma down here, which is innervated by the cervical branch. As well on the side, we have our cranial nerve 7 pathway. It exits through the styloid mastoid foramen, and then a section will branch off posteriorly, and that's the auricular nerve. And then the rest will branch off anteriorly and enter the parotid, where it will separate into 5 different branches. Those branches are the temporal, leading up here, the zygomatic leading here, the buccal leaving here, the mandibular down here, and then lastly the cervical down there. And then next we're going to do our placements for each of the cranial nerves and the branches for this nerve. We use a bipolar montage for this. So for the frontalis, which again is innervated by the temporal branch, we're going to place that in the middle of the muscle, about 4 to 5 centimeters above center of orbit. We're going to place these. You want to do them shallow at less than a 45-degree angle. And you're going to do them from lateral to medial. And then next for the orbicularis oculi, which is innervated by the temporal and zygomatic branches, again here, we're going to be placing from lateral to medial, and you want to place that, again, pretty shallow above the eyebrow here, making sure that your needles do not touch. And then next we have the nasalis here, which we're going to be placing laterally to medial, making sure that our needles do not cross the midline. And again, placing those at less than a 45-degree angle. And again, that's innervated by the zygomatic branch here. Then we have the orbicularis oris, which is innervated by the buccal branch here. And we want to place those lateral to medial above the lip, shallow at less than a 45-degree angle, making sure they don't cross the midline. And then we have the mentalis down here, which again is innervated by the mandibular branch. We're going to place those lateral to medial, less than a 45-degree angle, making sure they don't cross midline. And then last we have the platysma, which is innervated by the cervical branch here. And for those, we are going to place them in the middle of the muscle, lateral to medial.